So hopefully you can see my slides. And first of all, before I get going and talk more about our MSc programs, I just want to take a moment and tell you a little more about the Global Business School for Health. We're the first business school in the world totally dedicated to education in terms of health and healthcare management. We are a business school. We teach management, leadership, all the various areas within business and management, but we have a real healthcare focus because part of what we're all about is really addressing the health challenges from a business perspective. And more today, we've often historically looked at health and healthcare from a public health lens. But more and more today, we see that health and healthcare are really very much in the business sector. And it's one of the most growing and dynamic sectors within any economy on multiple fronts. So if we think about GDP, we can see that today, most countries spend between 10 and 20% of their GDP on health and healthcare related products and services. Also, we know that, excuse me, also we know that we are, talking about a sector that's now the fastest growing sector across the world. And needless to say, the pandemic has really put health and healthcare at the focus of much of our attention and our thinking because of the impact it's had, not just on our health, but on our societies and our economies. It's also exposed lots of inequalities in our society. So there's probably not a sector that's more important right now than healthcare. And so this school is really inspired and dedicated to health and healthcare. We have a number of MSc programs that I'm going to talk to you about today. I'd like to start by talking about our Digital Health and Entrepreneurship program. Again, it's a fabulous program. It's really designed to help you think about that digital health space. And that's such an exciting place to be. We're seeing more and more products. Of course, we often talk about telehealth. Telehealth, of course, is remote access to your physician. Some of you might already use that through apps or phone calls or video conferencing to get health and health care. But we see that this has a tremendous potential and is really taking off, particularly in terms of remote patient monitoring, which is the whole idea of allowing people to leave hospital early, to have access to their own personal health data, but also for their physician to monitor them when they're in their homes and in other places. And this is really where the future of healthcare lies. So, yes, there's medical technology, equipment, the use of AI and data to really enhance how we treat and prevent and monitor patients. But there's also a big push out of hospitals into the community that's being enabled by digital health equipment and innovations. So this program is just fantastic. It'll really offer you an opportunity to get a much more integrated focus, both from a health and from a business perspective, which is integral for really going into this very dynamic part of the sector, which I can add is probably the most invested in. Lots of the mergers, acquisitions, private equity that we're seeing in various markets is all centered around digital health innovations. So you'll really get the skills. You'll develop your skills and your strategies as a business person, but also as someone who can identify digital health solutions and really take them to market. There'll be opportunities for you to engage with industry to develop your health innovations and your ideas. So in terms of just thinking about what does it take to get onto this program, you need a UK degree. And ideally, you would have a classification at least a 2-1 or above, and an equivalency if you're coming from overseas. You'll also want to highlight any kind of experiences that you've had in your application, in your personal statement. And your personal statement will be very important for us in terms of identifying, those next leaders in this innovative space as in digital health. Also, you'll need, if you're coming from a non-English speaking country, you'll need an IELTS. You need at least a 6.5 or above, and in no area can you have less than a 6. And then, of course, you're going to need a reference. And you want that reference to be from somebody who really knows you, who can really speak to your ambitions to undertake this program. So that's really all the key admission information. So who is this program for? Well, it's really for people who come from a diverse group of backgrounds. So we're not just looking for somebody with a health background. You can come from a business background. You can come from a finance background. You can come from a science, engineering background. But you need to be an individual who really envisions yourself, going forward in some aspect of digital technology, a startup, maybe working in a large company, but in kind of a product development area, an entrepreneur, or you can be somebody who's going to work with people who are going to be implementing and taking forward digital technology. The program really is extremely exciting and comprehensive. You'll come, you have a 1-week induction. That's really an opportunity for you to bond with your class, get to know the academics on your program. You will also, have an opportunity. You'll be put into a team right at the beginning that you'll be working with to come up with an innovation and to build a business case around an idea. You'll also have the opportunity, even before you join, to take some self-paced courses in terms of global health that will be made available through our online portal for you to kind of prepare and for the program. So it'll be a very exciting time for you to really think about, just visualize what you want out of this program, how you're going to go forward, and to speak and get to know your colleagues and particularly your teammates that you're going to be working with. When you work on these projects, by the way, you're going to have industrial mentors. These will be companies and individuals and mainly startups who will be advising you and your colleagues as you work on your project across the academic year. So the program is really quite comprehensive. It's a 180 credits degree program. You're going to have 8 compulsory modules that you'll take. In term 1, you'll take digital health and entrepreneurship, so digital health startups. You have another module called digital opportunities that'll really give you a real wide spectrum of ideas, particularly thinking in terms of the bioscience kind of fields of digital technologies and digital health. You'll also have the opportunity to take a digital health and AI course. And then last but not least, you're going to learn about research methodologies. And that's so important because digital health tends to be a bit of the Wild West still. And so understanding how to show effectiveness and efficacy of your ideas is very important, particularly if you're going to take them out later and try to promote them or get investors, angel investors, or other kinds of investors to really invest into your ideas. So that first semester is really going to give you that groundwork and set you on your journey throughout this program. Then in term 2, you'll have a course called Changing Health Systems. Again, it's an opportunity to really get some comparative learning in terms of thinking more globally about all the different kinds of health systems that exist across the world, why that is, how they work. You'll also have a course on marketing, and that's going to be integral in terms of understanding that space for healthcare and particularly for digital health products, and how you enter the market and navigate there. You'll also have a course on human factors of digital health, and of course one on health assessments, which also has a focus on frugal technology. So you're going to get lots of information. You're going to learn so much that you're going to then be putting together in this project that you're going to work on with your industrial mentors. And then last but not least, you're going to have an opportunity to do an individual research project yourself. So the program is really comprehensive. As I said, you've got 8 modules where you're going to do lots of your key learning. And then you've got these 2 projects. And then alongside that, of course, you've got your assessments. And they're varied with coursework, written assessments, presentations, so that you can really put to work what you're doing. And in that first module in digital health and startups, you'll also have the opportunity to have a startup simulation exercise that you'll do along with your colleagues. Now I want to move on from digital health and talk to you about another really exciting program that we have. This is also very novel. You know, we are hearing so much about biotech, and we're also hearing a lot about the pharmaceutical sector and how they've really converged. You know, we hear about biopharmaceuticals now, and we also hear about how many biotech firms are being bought up by pharmaceutical companies, and pharmaceutical companies are buying up biotech firms. We hear a lot about the shifting landscape. And of course, with COVID, we've heard a lot about how pharmaceuticals have been at the cutting edge of really lots of the innovation with biotech firms. So this couldn't be a more timely and exciting program to get involved in. The program is not about teaching you the science. It's really teaching you the business side of biotechnology and pharmaceutical management, so that you can, again, be a product developer. You can be a strategist. You can come in and be a manager and really move up the ladder. So this program I'll talk a little more about is for such a varied group of individuals who really want to advance their knowledge in biotechnology and pharmaceutical from a business development and management perspective. So it's really about understanding where science and business interact. You'll have some fantastic courses. And again, you'll have the opportunity to work on a project with industrial mentors who will work alongside and advise you and your colleagues as you take forward your business case idea and pitch. So what does it take? Well, similarly to the other program, you need to have a 2-1 as a minimum or higher. You know, if you've got a first, that's fantastic. You want to, you know, ideally come from health or science, business or economics. Those are really good areas. You know, if you've got an engineering background, that's also really good for this program. And of course, biotechnology and pharmaceutical backgrounds are ideal. You want to really highlight in your CV and in your personal statement all the experiences that you've had up to this point that really make you an ideal candidate. In terms of language requirement, this one, you have to have a 7.0 or above and at least a 6.5 in all the subtests. I've mentioned your personal statement, but I can't emphasize how important that is. We do read all of your personal statements. We really scrutinize your application very carefully. So it is important to really explain why you want to do the program, what it is about your past and your experiences that make you a good candidate. And then last but not least, you want a reference from somebody who knows you well enough to really write you a very good reference. So this program is, as I said, it's really ideal then for somebody who's worked in biotechnology or pharmaceutical or had an internship or had some experiences and wants to kind of cross over into management. Or it could be for, you know, somebody who's, you know, wants to go into consultancy, you know, comes from the business economics background and looking to really move into these important sectors. You might even want to be an investor, somebody who works from the finance side, but needs an understanding of these. So it's a really diverse group of students that we're willing to take on this program to really, you know, think about how they want to use the skill and knowledge they'll acquire in this program to really take their career forward. Again, similar to the digital health, there's a 1-week induction. You will also have the opportunity to form as a cohort, get to know the academics, learn more about the day-to-day life of going through this program. All these programs that I'm talking about today are going to be delivered face-to-face. There will be a flipped classroom kind of element, so there will be lots of online opportunities and activities, but there will definitely be hands-on, face-to-face experiences that will be integral to your education. You will also have the opportunity to take our global health course online prior to join, so that you can understand more about the space in which we occupy at the Global Business School for Health. In terms of the modules, you'll start out in the first term, you'll take a 30-credit module in clinical trials and statistics. That'll really be important for you to get a background. You'll also take a module in pharmacoeconomics and one in policies and practices of pharmaceuticals and biotechnology. In term 2, you'll really start to then dive deeper into the business issues. You'll have a module in capital and private equity markets for healthcare. You'll do 2 modules in commercialization. So one is on with a more biotechnology focus on the commercialization of research ideas. And the second one is more on pharmaceuticals, on the commercialization and marketing of pharmaceuticals. And then last but not least, you'll have an opportunity to take a very important module, and that is on supply chain management for healthcare. So these are really important topics and that you'll cover throughout the program. And then again, you'll do the business project. As I said, you'll develop an idea for a new drug or biotech product, and you'll create a business plan and also have a presentation. So this is really a great experience alongside your research project. And that can be anything that you want to do, agreed with your academic supervisor. And it's an opportunity for you to just dig a little deeper into an aspect of your program. So now I want to move on to our third MSc program that I want to highlight for you today. This is our MSc Global Healthcare Management. It's a very popular program, so it's very highly competitive. It's really about understanding the kind of contemporary healthcare landscape, particularly from leadership and management skills. You'll get the theories, kind of the principles and practices of healthcare management, and look at it from very different lenses, because there's 3 routes. So when you apply for this program, you have to decide whether or not you want to do the analytical route, the finance route, or the leadership route. And I'm going to talk just a little more in a minute about what that exactly entails. But before that, I just want to again go over the admissions criteria. Again, you need at least a 2-1. I would say, really, given how competitive this is, you want a high 2-1 or a first will be ideal. It's open to people from lots of different diverse backgrounds, but science, health, social sciences, business, and other related topics. In terms of your IELTS, you need a 6.5 or above, and at least it's, I think that should be a 6 in all the subject tests. Your personal statement for this will be very important to focus it not just on doing global healthcare management, but in terms of which route you select. You need to be able to articulate why you want to do that particular route on this course. And then, of course, you need your reference. So who's this course for? Well, this course is really can be for people who are early in their career or just finished a bachelor's degree and want to pivot into health. It's really for people who see themselves going in, being managers, change makers in a healthcare setting. So again, as I said, you can be a recent graduate in any of these fields, and it opens a number of career opportunities for you, along with having your specialism. So how's the program? Well, again, you've got your 1-week induction, and you will also have the ability to take the global health self-paced course in the first term. And so I just want to take a moment here and kind of explain this to you. So in each term, term 1 and term 2, you'll take 2 modules in the kind of core areas. So for example, in term 1, you might take leadership and management in healthcare. It's a kind of general module. And then you might take also the kind of finance module. And then you'll take 2 modules in your specialism. So you'll be in this kind of wider, bigger group, very mixed class with everybody who's on the global healthcare management program. And then you'll have a smaller class that you'll be in, which will be just reserved for those people doing your specialism. And term 2 repeats that same approach. So it's an opportunity then, and that's why you have to pick your specialism when you're applying, because you will start right in term 1 into your specialism, as well as getting this kind of broader understanding of the global healthcare space. You also will do a business project, but it'll be slightly different. You'll be developing an idea for a health improvement from a concept to a business case. So rather than an innovation, you'll be looking at how you can innovate around healthcare improvements. And then, of course, you'll have your research project. So this is really an exciting program. And when we put this program together, we went out and we surveyed hundreds of employers about what they saw as really integral for what a student needs to learn on such a program. And that's how we really identified these specialisms. Because when we spoke to employers, they constantly came back to these 3 key areas: analytics, data, it's integral, it's the future of healthcare. And having individuals that understand the management and business space, but also analytics is so important. Then we found finance. And of course, when we talk about healthcare, we talk a lot about costs, we talk about budgets. So understanding and being able to really process and understand risk and accounts and reports is really important. And then the third area, of course, is leadership. Having courageous leaders, people who are change makers, people who can drive innovation through organizations and really embed it. That's so important to what employers are looking for. So that's really how we designed this program, and we believe that it has really lots of currency across lots of different health systems. I want to just take a minute now and talk to you about our MBA as well, because it's a very exciting program. And I think if you're someone who's had some work experience, and that work experience can be alongside your degree, this might be a real opportunity for you to get and be part of our real flagship program. The MBA in health is designed really to take people to the next level, to whether you're interested in going into private health, public health, into an NGO. The program is really world class. It has people from, KPMG, the CEO of UCLH, which is, one of the leading NHS trusts, and people from industry teaching alongside the academics. It's taught in a very novel way. I'll talk about that more in just a minute, but it's a really exciting program with some really innovative opportunities. And, this is really designed for people who are early on in their careers, who are looking to really get an edge, both in terms of opportunities, salaries, and launching their career forward. So the program has a much longer induction. It's a 2-week induction, and it starts really involves, of course, we'll have some online courses, but you'll not just have global health. You'll be able to take courses in accounting and finance and time management, study skills. It's a much more involved induction, because the program itself is like a sprint. You're going to learn so much. It's like going to a boot camp for business and management for healthcare. So it has a 2-week induction, and part of that is not just getting to know your cohort. You'll go away for a 3-day residential. You'll have a number of personality psychometric tests that you'll take to really understand yourself, your attributes. We'll again be putting you into a team because you're going to be doing a very hands-on project that involves field work overseas. So that 3-day residential, you'll have a lot of speakers coming in. It'll be facilitated by a leading health policy organization here in the UK. And it will really be an opportunity for you to visualize what you want out of this MBA. There's lots of career support that's throughout the MBA to make sure that you get the kind of jobs and opportunities that you want when you finish it. So how is this program different and how is it delivered? Well, you'll take 4 30-credit block modules. So this is really, you'll have a lot of online cases that you do. This is about really turning you into a confident decision maker in the healthcare and management and business space. So the first block is called Strategy, People, and Markets. You'll do a number of readings, you'll have videos that you watch, you'll do cases, and you'll come for 1 month, for 4 weeks. Each week has a different theme. The first week is strategy. The team that will be teaching you will be made up of leading strategists, both in terms of healthcare and in terms of business and management. The second week will be around human resource management and of course, healthcare space. And the third one will be marketing. You'll be doing a number of cases. Then you'll have a 4th week, which we call wrap-up week. Wrap-up week is where we'll bring in health professionals who work in these various areas. They'll be sharing their life experiences with you. They'll be doing interactive activities with you. They'll be challenging you with other cases. And then, of course, you'll have your assessments. Then you have a 2-week period where you'll prepare for the next block. And then you'll come back in. It's called Funding, Finance, and Regulations. The first week will be around accounting and financial reporting. The second week on corporate finance. And the third week on health policies and practice. And then again, you'll have a wrap-up week. Now, what I didn't mention to you is when you were in your induction, you'll be put in a team. And at UCL, we have what we call our grand challenges. Our grand challenges are where our researchers and academics work on big issues that affect and impact the lives of all of us as humans and mankind. One of those areas, of course, is health. So in the MBA, we have what we call our Global Health Challenge. You'll work on a project. You'll start it right there in induction. We put into a high-performing team based upon your personality testing, and you'll be assigned academics, and again, you'll be working with industry experts to solve a health problem in a developing country, a lower middle-income country. Currently, we're looking at projects in Nigeria, one in the Middle East, and one in India. Then you'll work on that project. When you after you've finished your first term and finished those first 2 blocks, the one in strategy, people and marketing, and funding, finance, and regulation, in January of that year, you'll go for 2 weeks for a field component to collect data, do interviews, learn more about the health system of the country where you're working on your global health challenge, a solution. You'll come back after that and continue to meet with your group across the year, and you'll go into your next block. Your next block is called data-driven management. It involves a week of health economics, a week of data analytics, and a week of then sustainability in healthcare, and then your wrap-up week. And then your final block will be contemporary topics in health and healthcare. Again, you'll have digitalization and innovation in healthcare. You will have systems thinking for healthcare. You will have a module opportunity around changing health systems. These are all going to be, you'll have about 5 options. You'll pick 3 of those that you'll do that week. And then, of course, you'll have a final wrap-up week. Then in your 3rd term, you'll work with your colleagues to finish off your Global Health Challenge project, and you'll also undertake a health consultancy project. So it's a real busy, you know, like I said, I call it a boot camp because it's a really intensive, but the education and the thinking and particularly the focus on case studies, simulating lots of information very quickly and making decisions will be an important aspect of really pushing you up and building your confidence for going for senior roles in consultancies, and taking it to the next level. So I've already mentioned the Global Health Challenge, but this is just a little more information on it. As I said, you work on this project. The project will be focused on a lower middle income country. You'll have a 2-week submersion field experience. You'll work as a team, and your final output will be a research paper and presentation. It really will give you that kind of experience of what it's like to be a consultant working on a project in the kind of global health economy. And then the other thing is the other project, of course, is the Health Consultant Project. And that project, by the way, that will be a real world project. So we will be soliciting bids, project from NHS trusts, from private health organizations, from charities, and you'll have a career coach throughout your MBA program who will help you kind of think about which project would be best for you to work on in terms of thinking about your ambitions and where you want to go after you complete your MBA. And that will help you determine which project you work on. Again, depending on what project you work on, you might do it individually, you might be doing it in pairs, or you might be doing it in a small group. So that's really, I think, very important. And then, you know, who's this for? Well, this is really, as I said, this is for people who really want to go into leadership in healthcare, maybe be a management consultant in healthcare. You know, it's for managers, clinicians early on, business specialists. It's really about giving you that experience of pivoting your career or accelerating your career to really move up in that healthcare space. And so you can come from really a very diverse background. Again, you need a minimum of a 2.1. You need the language of a 6.5 or above. You need work experience, but that work experience can be contextualized. So it can be through volunteering, it can be an internship, it can be through working a job. And it's very important that you articulate that and explain that both in terms of your personal statement and in terms of your CV. You need a well-balanced GMAT score, and the GMAT can be taken at any time. It can be taken online. You can do a practice test to see how you would do and prepare for it. And then you'll have an interview. And then you've got 2 references for this program. So it's a great opportunity. And I really encourage anyone who feels that they could meet this criteria to really apply for this program. It's a fantastic program. Now, I'd just like to turn to our scholarships, because I know funding is always really important when you're going on and doing postgraduate education. There's lots of opportunities, and later on today, we'll have a session just on funding and scholarships. So I also encourage you to attend that. I'd just like to highlight that within the school, we've got 3 different scholarships. We have a scholarship program for the MBA Health that I just described to you. It's called Future Impact Leaders Scholarship. It can be up to £15,000 towards your MBA fees. And again, it's for people who are coming on to the MBA, and you can find on our website the criteria for applying for that program. There's also a Women's Healthcare Leaders Scholarship. And again, that's up to £5,000 that can be put towards your fees. There's also an added component for that. You'll get coaching. There's a kind of a leadership program and workshops that you'll have exposure to and be able to go through to help you develop more as a leader. And then last but not least, we have our East London Healthcare Leaders Scholarship. That's because we're going to be located at UCL East, and East London is our community. And so if you live in East London or you work currently in East London, you can apply for up to £5,000 to put towards your fees. And again, as I said, UCL has other scholarships. There's lots of opportunities, both for international as students and home students. And you can learn more about those by attending one of our scholarship sessions. So just to give you some ideas about that, if you're coming from the United States, you can get a US federal funding. You, of course, if you're a UK student, you can qualify for different funds. UCL also has a range of graduate taught funding programs you can find on the UCL website. And then for international students, the Chevening, the Commonwealth, the Fulbright, Great, Master's bursaries. So there's just lots of opportunities, and I really, really encourage you to explore those. Sometimes students can be a bit complacent, but if you qualify or if you think you qualify, I really encourage you to apply for some funding. Then I just wanted to say a little more about careers, because really what the Global Business School for Health at UCL is really about is about creating, launching, and educating the next generation of future leaders in healthcare. We take it really seriously. We really look for our alumni to make a difference in the healthcare sector. So throughout your program, whether you're doing the MSc or you're doing the MBA, we'll be constantly reaching out to you, helping you, making sure that you're getting the support you need to make sure that you get the outcomes from this degrees and programs that you expect. It all starts right in week one, right in your induction. And even before you start, we'll start reaching out to you about your personal, professional development. There'll be workshops that you can attend throughout the year. There'll be lots of speakers. We have what we're calling the Health Executive in Residence program. That'll be senior leaders and CEOs from health organizations who will have agreed to have office hours, both during term 1 and term 2, that you can sign up for to get counseling advice from these various leaders. We'll have 25 of these leaders. We'll have their profiles shortly up on our website. And during your time with us, you can look to them for coaching and advice. We also, as I mentioned to you, in every single one of our degree programs, again, whether it's the MBA or the MSc, we have some sort of group project. That's because we know that companies, they really look for people who can be team players. But also, if you're going to solve the world's health problems, you need to be able to work in cross-disciplinary teams. You need to be able to work with different kinds of people. You need to be able to be inclusive in how you approach other people and work with them. So that's such an important part of what we do at the Global Business School for Health. So throughout your year and throughout your program, you'll have a tremendous amount of coaching, industry events, industry mentors, people you can talk to. And then, of course, at UCL, we have fantastic career services, and they really take their job very seriously. They will be reaching out to you. We also have innovation in enterprisers services. And last but not least, of course, our UCL alumni network. And as soon as you become a student at UCL, you become a part of a big family of very, very successful individuals, and many, many of them in the health space. So UCL is just such a great destination. And your career destination can be whatever you want it to be. But some of the areas are, health consultancy. We see our students as being very competitive for places like Deloitte, McKinsey, KPMG, EY, and of course, pharmaceutical companies, the NHS, insurance companies, global world health organizations like the WHO, All of these will be at your footstep. And also, of course, if you want to go into the startup market, it's a great place to think about a career, to launch from, you know, your experiences at GBSH. So I've talked a lot about your academic side. I've talked a lot about, you know, really shaping, curating your career. But also at GBSH and at UCL, we expect you to have just a lot of fun. There's so many opportunities to really get to know other students, to join the student union, to be parts of clubs and societies. We really hope that our students will set up the first MBA Health Society, the first Healthcare Management Society, the first Digital Health and Entrepreneurship Society, and of course, the Biotech and Pharmaceutical Management Society. So we really want to encourage our students to get engaged, to be engaged. You know, students that are engaged and really fully get into their degrees tend to have the best outcomes. So there's also opportunities for you to volunteer. There's other societies, of course, that you can get involved in. And then, of course, there's also student support and well-being team. And I mention that because today, all of us have been through a lot. The pandemic has taken a lot out of us. And sometimes you need someone to talk to really help you with your mental health, your well-being. And we have just great support services at UCL that you can tap into and be a part of. Also, I just want to mention that our campus will be a brand new facilities at UCL East. These are state-of-the-art facilities, and the Olympic Park is just a beautiful, wonderful place to be a student. And, you know, of course, there's facilities, there's art facilities, there's athletic facilities on the park, but East London itself is a really fascinating place. There's lots of places for eating, shopping, and it's just an 8-minute ride from Stratford to kind of center of London and our Bloomsbury campus. So there's many, many opportunities. And then last but not least, for students who are coming from overseas, if you're familiar with London, you already know what a magnificent, great city it is. It really is a special place. It's got amazing tourist attractions, museums, you know, most of them are free, galleries, institutes. It's just a real, you know, hub, center of culture and activity. I think some of the most beautiful and extensive parks in the world are in London. And as you can see, London has been ranked as the top city for students in 2021 QS rankings. So it really will be a great place to be a student and to live and to learn and to be a part of such a wonderful school like Global Business School for Health. So that's really all of my presentation. I just want to flag up to you some other presentations that are going to be coming up. As I mentioned today, this afternoon, I know for some students, the time they might be, you know, sleeping, but we have a scholarships and funding information session today at 5:30 p.m. Next week, or later on this week, I'm sorry, we've got a UCL MBA Health. So again, if you want to learn more about the MBA Health, we've got something on the 14th. Next week, we've got an event on biotech and pharmaceutical management, as well as digital health. So these are all great opportunities for you to learn more just about all the excitement in our school. And of course, if you haven't visited our website, please visit the website, take a look, spend some time. If you've got questions, you can you know, contact us. There's buttons on there for, you know, logging your interest, asking questions. We've got on every single program FAQs so that you can see those as well. So that's really all I've got now in terms of my presentation. I'm just going to look at the Q&A and see if you've got some, and I'm going to take down my presentation screen, but I hope you found this informative. So I have the first question is, could I inquire about the acceptance rate for the biotech and pharmaceutical management and which year this degree was introduced? This is all of this is a new program, and we are accepting students currently. We do have a number of applications. So I think I can give you an exact acceptance rate, but if you're interested in the program, I would surely, encourage you to apply. Then the next question, how easy it's to take the part-time MBA while working a full-time job? So that's a very good question. I think it's doable. It's a lot of work. We will have, just to let you know, a executive MBA that will be launching in 23-24. That is a part-time MBA. It's mainly online. If you were to do this one, you would need in term 1 to take one of those 4-week blocks. Those 4-week blocks, each week you'd need, kind of an afternoon every single day in the week to attend during that 4 weeks. And then you'd need the other 4 weeks for the second term. So it is doable. And you could, if you needed to work in the morning and then come into the afternoon, you could do it. But you would definitely need to have your employer on board to undertake that program. But it's a fantastic program. And I think really, if you're able to swing it, it's worth it. Hi, Professor Colton, may I ask what is the expected size of the MSc Global Healthcare Management Finance program? We're planning to have around 50 students on that program. And we're, again, recruiting to that currently. The next question, how much contact time is there per week? Seminars and tutorials, for example, on the digital health. So every week during term time, which runs across 10 weeks, you could expect to be on campus 2 to 3 days a week. In terms of contact time, you'll have about 3 hours per week per module. So again, that's about 12 hours of face-to-face time. And then you'll also have synchronized online time. You'll have lectures that'll be online. So you'll have a real mix. So when you add them in, I would say, gosh, probably around 16 to 20 hours of kind of contact time over a week. Then the next one, what times and days the face-to-face sessions are usually taking place for the MSc Global Healthcare Finance route? Part-time, is it possible to work full-time? Yeah, I think you could expect that you would have to be on campus at least 1 day a week to do that program. We're just putting the timetables together, so I couldn't tell you exactly what day, but you would have to be at least available for a day a week. And if you were doing it full-time, you'd need at least 2 days a week to be on campus. So I think you could work full-time, but you would have to, again, negotiate with your employer to have at least a day a week off to be in class. And again, if you want to reach out to us, we can try to get you more information. Hi, Professor Colton. Declan, there is no question there. So I don't know if you were writing a question, but there's nothing in the chat to answer to. So I'll just wait another minute or so if you don't have any other questions. Again, I'd be happy, if you've got individual cases or questions, please do email or write to us. We do want to make these available for part-time students. And so, as I said, if you're a part-time student, I can't give you the exact day, but you could anticipate that you would need 1 day a week off of work to make sure that you can attend. And if you're going to do the MBA part-time, you would need to, and you want to do the face-to-face, you'd have to expect that over those kind of 4 weeks that you'd need your afternoons off each week during that time. So a question, do you believe that the MSc in biotech and pharmaceutical, it's actually management, will grow in relevance, or is now the right time to complete this program considering the growth in the industry? I think that this is the right time. These industries will continue to grow. I think you're going to see a lot of shifting in these industries, and that's why taking this program where you're going to get exposed to both. I think that we may see a lot of biotech firms acquiring pharmaceutical companies, and pharmaceutical companies acquiring biotechnology firms. What we're currently seeing in the market is that a lot of the biotech firms are actually the ones doing the drug development, and then it's the pharmaceutical ones that are actually doing the manufacturing. So I think this is a really exciting time to get into these industries, to get the kind of management skills that will allow you to really push forward. If you're able to look at our YouTube channel, we had a great event around careers with one person from a startup, and Harry Kumar, who of course spent his career at Roche. And I think both of them really advocated that this is the time to get in, and that these sectors will just keep growing and developing going forward. We have another question. How do you evaluate the difference between pharma and biotech management and healthcare management degrees? Well, I think that the biotech and pharmaceutical is much more focused on those industries. So if you're interested in getting into that either biopharmaceutical, pharmaceutical, or biotech sector, whether that's even from a finance investment side or from a product development or a management side, I would say that's the program for you. I think the healthcare management program is designed to give you a much more kind of leadership and management focus with a much more general kind of healthcare management. So it's not necessarily, you're not going to get the kind of specifics of the industry. And so if you really want to get into pharma and biotech and into that management space, I would say you want to do that program rather than the healthcare management. But if you're just not sure and you want to do healthcare management and you think you might want to do it, then I would suggest that's a better program. So it's really, where do you see yourself, Peter, going forward, and what is your interest? Declan, to what extent would it be applicable to complete an MBA following the MSc in biotech and pharmaceutical management? I am coming from a pharmacology background. Of course, you could do both and do it across 2 years. And if you've got the ability to do that, that's quite exciting. I think the difference between the two will be that the MSc in biotech and pharmaceutical will be much more industry focused on those industries. And you'll get those kinds of insights and that training along with management and training. The MBA will give you a much kind of broader business and management focus. And I just want to be clear too, our MBA is very much, you will get all the different areas that you get in an MBA, but you'll get with a health focus. So if it really, again, is what are you thinking about? If you're thinking, and you're early on in your career, what you might want to do is, and you think you'd like that, and you're coming from that pharmacology background, you might want to go for the biotech and pharmaceutical management, work for a few years, and then come back and get your MBA. So another question, anonymous. So basically, I am working in a pharmaceutical company as an executive in quality assurance. I'm right after I graduated with a first-class honor in chemistry. will the biotech and pharmaceutical help me climb up the corporate ladder fast? Yeah, it would definitely do that. I think also the MBA is actually designed to help people who want to accelerate their career. So you might take a look at that as well. It's got a much more focus with the intent of being for people like yourself who really want to, step up and move quickly. So if you're already in a pharmaceutical company, you might look to the MBA as well as the biotech and pharmaceutical management. I think if you're, a lot of times people in pharmaceutical companies often get very pigeonholed into certain areas. And so if you want to get that broader understanding, look much more at the product development, the innovation kind of side of things of the business as well as the management, then you will definitely get that in the biotech and pharmaceutical management program. Okay, so I think we're just upon the hour. I'll give it just one more moment to see if there's any further questions. So I've got one more question. I have a 2.2 in my degree in economics at UCL, which I now know falls short of the entry requirement, but I have 20-year career in digital technology. Does that work taken into account as part of my application? I think, yes, it does. But I would probably say if you've got 20 years of career experience, I'd really push you towards the MBA. I think it's more designed and will weigh heavier in the application and in the decision process on your career experience. You will need to make that really clear and articulated in your personal statement in your CV. Because of course, all of these programs are highly competitive and we've got lots of applicants that already meet or exceed the minimum requirement. But if you'd like to have a conversation offline, please feel free to reach out to me or our admissions team. But I think I would say with 20 years experience, you might find it much more beneficial to aim for the MBA. I am a dentistry graduate from India. Can I know what my chances are to be accepted into the MSc Biotech and Pharmaceutical Management? Well, again, it's really about the whole package. Dentistry, of course, fits in there and gives you that kind of health and science background. So that's all very attractive for coming on to this program. Assuming that you've got a 2.1 or above, and you've got a good strong personal statement, I think you'd be definitely qualified to come onto the program, and I encourage you to apply. Declan, apologies, Professor Colton, but what is the class size and acceptance rate for the MSc in Biotech and Pharmaceutical Management? We're taking around 50 students, assuming that we get, the kind of caliber and quality that we're looking for. So it's, there should be about 50 students in that class. So again, Declan, really encourage you to apply. All right, so I see we're right at the hour. I want to really thank all of you for your time, your attention, great questions. And again, please feel easy to follow up, email us. And I'm really excited and looking forward to having all of you join us in September. So have a great day and take care. And remember, there are other events that you can attend and specific events next week. Bye.